Hi, I'm Dr. Chris. I'm a practicing chiropractor. I'm the founder of Muscle Care. I see 55,000 patient visits a year in my practice. We understand pain. If you or anyone you know or love loves to snowboard, because I do, give them this mini series of stretching, because there are certain muscles that people just don't think about that get really strained when you snowboard, and it can affect your day and your enjoyment of your day. This will help them tremendously. The Super 6 rules to stretch are: warm up, be gentle, no sharp pain, breathe, always do both sides, don't bounce, and always hold for at least 30 seconds or until you feel the muscle relax. Now that you're warm and you're ready, let's get some relief from the aches and pains of snowboarding so that we don't fall and hurt ourselves even more. Have a great day. Go into your side, stretch ear to shoulder. Do not let the nose tilt down. Keep it straight ahead. And then rotate the nose up to the left. You'll stretch the front of the left side of the neck. If you want more, hold your arms behind you for more stretch of the connective tissue of the front of the neck and the anterior chest wall or the front of chest. Do the same on the other side. For the front of chest stretch, your right arm should be perpendicular, parallel to the ground, and you would actually try to hook your hand onto a wall for support. And if you can extend your fingers backward in order to open up the fascia and connective tissue of the forearm and the hand, you'll get a much better stretch all the way up the arm, all the way through the chest. But remember, what you want to do is feet are planted square on the ground, and you rotate your body away from the side you're stretching. That includes your neck. So if your right hand's on the wall, you'll turn your face and your torso to the left. Okay, do the same thing on the other side for balance. For the rotator cuff and the posterior or the back of shoulder, again, right arm across the body, keep the right arm parallel to the ground. Grab the elbow with your left hand, pull it close to your body. Feel that stretch in the back of the shoulder already. And then turn the torso, the face, the neck, everything as far as you can in the direction your fingers are pointing or to the left. Do the same on the other side. Now, for the front of leg or quadricep, we call it stretch, what you want to do is you want to make sure that you're standing holding a wall with one hand, the right hand, and then you'll pull your left heel up to your buttock and you'll grab the front of the ankle on the left with your left hand. Try to hold that foot and heel as close to your left buttock as humanly possible, and that's when you go through those Super 6 rules of stretch. Now remember, again, this may be tight, you may not be able to get it all the way there. It's not essential that you touch your heel to your buttock, just as long as you feel the front of leg stretching. Do both sides. Once we want to do our hip flexor stretch, we can roll directly from our front of thigh or quadricep stretch. We can put our right hand on a chair for support. And all we do is, as we want to stretch our hip flexor, it's important that we try to pull our left leg back. So the left thigh, you're trying to get it closer and closer to parallel to the ground as you hinge at your waist and you move forward. So when your body is really doing this well and your hip flexors are stretched out, you'll be able to make a T. Your right leg is on the ground, that's the bottom of the T, and your torso and your left thigh create the top of the T. For an effective side of leg stretch, remember that the iliotibial band, tensor fasciae lata, very, very, very tight adhesive sort of tissue, because that stabilizes your pelvis so you don't fall over. So those stretches take a little longer and you've got to be patient. So you stand facing away from a wall, put your left hand on the wall, and what you'll do then is support yourself. Now your left foot stays planted on the ground. Your right foot crosses in front of that left leg. And then what you'll do is your right hand goes on your right hip, and that pushes the hip toward the wall, but you're stabilizing and holding the wall. This way you're going to be stable and you're not going to fall, but you're going to have to breathe deeply for at least 30 to 60 seconds. Notice I said 60 because fibrous tissue doesn't have a lot of blood flow. Blood flow brings magnesium into those tissues and helps them relax. So again, it's going to take longer than an average muscle. Do both sides. For the buttock and the lower back, lie flat on the ground, head down. Left leg stays on the ground flat, don't bend it. Lift the right knee up, reach behind the hamstring closer to the knee, and pull that knee back, because a lot of people have knee issues. So let's not squeeze the knee and grab it on top. Hold it behind. Pull it to that chest on that side. To stretch effectively the front of the shoulders, we can grab our hands behind us, lift the hands away from the body, and reach back and up, holding for, again, 20 to 30 seconds, opening the front of the chest and shoulder girdle. Do not let the head drop forward. Keep the ears over the shoulders and then relax. For the lower chest stretch, the right arm, for example, has to go 45 degrees above the horizontal, so it reaches up, making sure that the palm of the hand is held onto something tight and strong like a wall or a post. And if you can actually extend the wrist or the fingers backward while you do that and turn your body away from that side, including the head and neck, you're going to stretch all the connective tissue of the chest and the neck that all work together. For the wrist extensor and flexor stretch, hold the arm straight. Make sure the elbow is locked. Push the wrist down and use the other hand to pull the forehand toward the body. Keep the fingers straight. Maximize the stretch through the entire extensor surface. Hold that until the burn goes away or that stretch goes away. Then, to stretch the flexors, just simply keep the arm straight, pull the fingers up, push the palm as if it's going forward, and pull those fingers back toward your shoulder. Hold that for 30 seconds, or at least until the burning in the bottom of the flexor muscles go away. Now, reach around out front. Put the left hand on the back of the right one and push away from you, but do not round out. Stay straight. Open those muscles up in the upper back. Stretch them. Keep the head straight, ears over shoulder. 5 to 10 seconds. Repeat that 5 to 10 times. One of the best hip and spinal stretches you can do is when you sit on the ground, legs out in front, bend the left leg up so that you can lift your left foot over the right knee. Rest the foot flat on the ground and then keep your body at 90 degrees to your legs. So what you're gonna do is you're gonna turn your upper body to the left and hook your right back of elbow on the outside of the left knee. Make sure that your face, neck, upper back are all twisted to the left, and use that right elbow on the outside of the left leg for leverage. Deep breathing. Make sure you can breathe, because if you can't breathe, you're stretching too much. That is a fantastic stretch, but you're stretching a lot of large tissue, especially in the hips and the gluteus area, so holding that a little longer may be needed. This is the anterior shoulder reach stretch. This one's great for people that have had rotator cuff chest injuries or even frozen shoulder. Just walk the fingers up the wall. Get comfortable wherever you are without sharp pain and just leave it there. Breathe gently through that position and then slowly but surely go further into the stretch. This will definitely improve comfort, confidence, and range of motion within those muscles that have been traumatized. Sit torso 90 degrees to your legs, both legs straight out in front of you. So if we can take the legs out to a V shape, we can actually get the inside groin or adductor muscles and the hamstrings to stretch together. Just lean your palms onto the floor and glide out between the legs, keeping the body hinged at the waist, not rounding out. The full body stretch. Let's stand, feet shoulder width apart, pelvis square, shoulders over pelvis, ears over shoulder, arms up in the air, straight up in the air to the sides of our ears. They don't lean forward, they don't lean back, and they reach up. We hold that, we deep breathe, and then if we really want more stretch, we go up on our tippy toes and try to reach the sky. You feeling better? I knew you would. Listen, why don't you continue your pain-free journey by clicking the link in the description below and access my full stretching series and share the relief of pain and stress with friends and family. And you know what? If you really want to feel even better, why don't you try this? Muscle Care is the new sub-topical, all-natural, evidence-based pain, spasm, and inflammation reliever. You're gonna love it. It's easy to use, simple to put on, no mess, no fuss. It's a roll-on. I'm Dr. Chris, and have a great day.